Hello, everyone. My name is Colleen Hernandez from CGI Business Solutions. I am here today to review your open enrollment plan options. I'm going to be reviewing the information that you can find on the benefits at a glance. Did everybody get a copy of that before this meeting? Okay. First thing that I want to mention is that your benefits are going to begin on August 1st. And
I didn't get a copy of that thing. Was it emailed or?
I didn't either.
Cheryl, I had sent a copy to you and Nicole.
I didn't get a copy either.
Okay, hang on one second, everyone.
I can forward it out while you're talking.
Okay, perfect. So check your emails. It's on its way. So benefits start August 1st, last through July 31st. You will be married to the elections that you make for the entire plan year. So it's important that you understand the benefits. During a plan year, you do have the option of changing your elections if you experience a qualifying event. Some examples of qualifying events are discussed in the gray box in the middle of page 1 and include if you're married, you're able to bring your new spouse onto the plan within 30 days of the date of marriage. If your spouse's coverage elsewhere, they lose their coverage through no fault of their own, they can come on your plan within 30 days. Birth, adoption, divorce, other reasons that you can make changes to your plan. Again, everything has to be communicated within 30 days of the date of the change. Please keep in mind that regardless of a qualifying event, you're only able to change your dependents, and the plan that you elected cannot change. So the plans that you are going to pick will be your plan for the entire year. We are going to be able to continue with Blue Cross Blue Shield. We will be continuing with Blue Cross Blue Shield and Guardian for our dental and vision needs. This year, we're going to be offering a few different options within Blue Cross Blue Shield, so it's important that you understand the differences and make the best decision for your own individual needs. The bottom of page number 1 is a refresher on how you can locate a participating provider for both your medical and your dental. Being a small group located in the state of Florida, you are able to keep your children on your medical policy until age 30, no questions asked. Dental and vision, your dependents can remain on until age 26, no questions asked. I did want to point out a little section in the middle of locating a participating provider. There are now 2 different networks that we're going to be utilizing. It's going to be the Blue Care or the Blue Options. If everyone can turn to page 2, we'll review the medical benefits, and I'll talk about the differences between the plans and the networks. The first plan we're going to look at is the Blue Care 16253. This plan uses the Blue Care network. I know I just noticed it says Blue Options over here. This is incorrect. Right at the top, it says Blue Care. It is the Blue Care network, so I will update this and get it out to you. It utilizes the Blue Care network, which is the same network as in plan in column number 2. This is an HMO product, meaning you do not have out-of-network coverage. However, you do not need a referral to see a specialist. It is possible that if you go to a specialist, they are going to ask you for a referral, and all you need to do is politely inform them that you do not need a referral, and they are more than happy to, verify that with your insurance company, if they so choose. A lot of times, front desk staff, they just see the word HMO and they assume. I know that it has gotten better over the years. However, this does still happen occasionally. So I do want you to rest assured that you do not need a referral. On this plan, you have copays to see the doctor, $25, specialist at $55. All preventative services absolutely free. You walk in, you walk out, no charge to you for preventative type services, including well child and child immunizations, your regular routine physical, a well woman exam, colonoscopies for individuals over age 50, and mammograms for women over age 35. The next thing you see is going to be emergency room. The emergency room is a $300 copay after you satisfy your deductible. The deductible on this plan is $3,000 for an individual, not to exceed collectively $6,000 with family coverage. One individual within a family unit will never pay more than the individual deductible, though. Collectively as a whole, you guys will never pay more than the family deductible. After you pay your $3,000 deductible, you will then pay an additional $300 copay for the emergency room visit. Your second time you go to the emergency room, since your deductible would already have been satisfied, you would only be paying the $300 copay. Urgent care, there's a $60 copay. Labs, there's a $50 copay. The participating lab within the Blue Florida network is going to be Quest Diagnostics. X-rays, there's a $150 copay. However, it is quite possible that you will be charged less for an X-ray because you will never exceed whatever the contracted rate is. So if I needed to have an X-ray of my finger, one little lowly X-ray, and the contracted rate is $57. Instead of paying a $150 copay, I will only pay the $57 because they can't charge me more than they're paying for that cost of service. Advanced imaging, there is a $350 copay. Inpatient hospitalization, it works just like that emergency room where first you must satisfy your deductible and then there will be a $1,000 copay. Again, as a reminder, once your deductible is satisfied for the year, it is satisfied. You do not pay anything else towards that deductible. You will just pay that $1,000 copay then. Outpatient surgery is a $500 deductible. $500 copay. Deductible, as I mentioned, was $3,000 for an individual, not to exceed $6,000 for a family. Your out-of-pocket maximum, though, is $7,900 for an individual, not to exceed $15,800 collectively for a family. That out-of-pocket maximum, that's your all-in number. That's going to be your deductible if you had any co-insurance, which you do not on this plan, and I'll explain what that is on the next plan, and copays. Everything is rolling towards that out-of-pocket maximum. That's your worst-case scenario in a given calendar year. A couple things that I did want to mention. Whatever money you have already satisfied towards your deductible and out-of-pocket maximum will stay with you. So if you choose to move from your current plan to this plan, anything you've already accumulated will follow you, and you're only going to be responsible for the difference. Come January 1st, both your deductible and your out-of-pocket max, they revert to zero because it does follow the calendar year. As I mentioned earlier, there is no out-of-network benefits. However, in the event of a life-threatening emergency, please do not worry about the network. You're going to go to the closest emergency room, and it will be covered as if you were within the network. Prescription drugs on this plan, Tier 1 is a $15 copay, Tier 2 is a $75 copay, Tier 3 is a $150 copay, and your specialty medication is a $300 copay. Any questions about the plan in column number 1?
I have a question. If you're going to have a routine colonoscopy, will you still have to pay that $500 copayment at the facility, the outpatient surgery center?
You will not, as long as it is truly a routine colonoscopy. What that means is that it'll be a preventative type service. You're not going
Mhm.
because my stomach's been bothering me and I think I have something going on, so let me have a colonoscopy. It would have to be coded as preventative, and during the colonoscopy, if they find a polyp and they have to remove a polyp, which they're naturally not going to wake you up and say, are you consenting to me removing this polyp from your colon? So they're just going to go in and automatically remove it. At that point in time, that preventative colonoscopy now becomes exploratory surgery, and they are removing anything, and you could be charged the $500 copay at that point in time then.
Okay. Thank
But
you.
if everything goes smoothly, you will not be responsible for that outpatient copay.
Okay. Thank you.
My pleasure. Any other questions on this plan? Okay, we're going to talk about the plan in column number 2 now. This is the Blue Care 14354. It uses that same Blue Care network. So it's an identical network to the plan we already previously discussed. It is a slightly smaller network than the plan that you are currently on. However, it is still a very large, robust network. But if you're going to make that switch, I just suggest everybody look at their doctors to make sure they're participating in the network. This plan is going to mirror almost identically the plan that you currently have. There are a few small differences between the plan you're currently on and this plan. We're going to look at columns number 2 and number 3 together at the same time. Column number 3, the blue options 14054, that is the plan that you are currently on right now today. Both plans have a $20 primary office visit copay, a $50 specialist copay. This and all plans are going to be preventative, no cost to you. The Blue Care 14354, the emergency room is subject to deductible and coinsurance, while your current Blue Options 14054, there is a $200 copay. Urgent Care, $55 copay for both of the plans. Diagnostic Laboratory, on the Blue Care 14354, there's a $50 copay, whereas you're currently not responsible for a copay at an in-network lab. Any x-rays or imaging, you currently have a copay for it, either $50 for an x-ray or $300 for advanced imaging. That will be subject to deductible and coinsurance on plan 14354. And then inpatient, outpatient surgery, both plans are subject to deductible and coinsurance. Deductible is $1,500 for an individual, $3,000 for a family. Then you pay 20% coinsurance, not to exceed $5,000 for an individual, $10,000 for a family. Let me give you an example of how deductible and coinsurance work together. Let's say, God forbid, my child needs to go to the hospital, they have surgery. I'm responsible for the first $1,500 of that bill. After I satisfy the first $1,500, I then pay 20%, and Blue Cross Blue Shield picks up the 80% until I have paid $5,000 for my out-of-pocket maximum. Again, the out-of-pocket maximum is going to include the deductible, coinsurance, and any copays that I may have paid throughout the year. So that's the end-all, be-all, worst-case scenario as long as I stay within the network. The 14354, no out-of-network coverage, whereas the Blue Options 14054 you're currently on does have coverage for out-of-network. However, if you choose to go out-of-network, which you may do so, you will be responsible for a larger portion of the bills, and it is possible that you could be balance billed, meaning the provider or facility that you chose to go to, they may come back and say, that's great, I'm glad that I got this amount of money from Blue Cross Blue Shield, but I want more because I'm not in the network and therefore I never agreed to take the contracted rate, and you're going to pay me the difference that I billed you and the difference that I received. Both of the plans, exact same prescriptions, $10 tier 1, $30 tier 2, $50 tier 3, and $150 for the specialty drugs on the 14354 and the 14054. Any questions? Because I know this can be confusing, and this is the part that I really want to make sure everybody understands. Okay, excellent. If we look at page 3 is just a informational piece on ways in which you can save money on prescription drugs. This information is not through your insurance carrier, and you actually do not need insurance to take advantage of these programs. Walmart and Winn-Dixie, they offer $4 30-day or $10 90-day supply of medications. Publix, they actually offer free antibiotics as well as some free routine maintenance medication. And then I know a lot of people are becoming more familiar with GoodRx, which is a website where you can type in the name of medication you're looking for in your zip code, and pharmacies that contain the medication will come up, as well as a link for a coupon if the manufacturer has any coupons available for the prescriptions that you're taking. We're going to flip to page 4 so we can talk about some more money saving options for you. Florida Blue has some Florida Blue centers and some medical practices that they call clinicianistas. I know that there's one within Boynton Beach, and there's actually several locations throughout South Florida. Some of the locations you're able to get not only see a primary care doctor, but urgent care and have imaging done, including advanced imaging. The information as to where you can see an urgent care at one of these clinicianistas or which one has imaging can be found online on BlueCrossBlueShield.com. And going to one of these providers is going to cost you significantly less, in some cases as little as $5, whereas on your medical plan, you could be paying $20 or $25 to see a doctor. You can pay as little as $5. And you can log on to mysanitas.com to find the center in your area. It'll have a list of all of the different services that they have at that particular location. Page number 5 is another way to help you save money. Florida Blue has Teladoc built into each and every one of your medical plans. Teladoc generally would cost you $10, and you'll then have access 24/7 to an actual licensed medical doctor that can meet you virtually, either over the phone, online, FaceTime, or I forget what the other version of like FaceTime is, where you can see the doctor. Great for, I think I have pink eye, I have a little rash on my arm, my throat is hurting, I'm really congested, can you call in an antibiotic? Generally, it's only going to cost you $10. Right now, due to coronavirus, it's completely free. I don't know how long that's going to continue for. It seems to get pushed out and pushed out as we are not through this pandemic yet. However, this is definitely a more affordable option, even at the $10 copay. Page number 6 just talks about the top 25 diagnoses within Florida that Teladoc actually treats. So you would be surprised, like I said, a whole variety of different things, but this is not the, hey, I slipped, I fell, I hurt my back, I think I need some Vicodin. They cannot prescribe any kind of painkillers. It's going to be strictly antibiotics. Like I said, great for if you're not feeling well, maybe your child's not feeling well. The only people that can use this benefit, though, are those covered by your medical insurance. So if you have a child not covered by your medical plan, they cannot call in and use the service. Any questions about anything that we've talked about so far? Okay, with that being said, let's flip on over to page 7 and let's take a look at your dental benefits. Dental plan has remained exactly the same. No change at all to your dental benefits. So just as a little refresher, you have a PPO dental plan offered to you by Guardian. Each and every calendar year, you're given a $1,000 benefit to use. That benefit is $1,000 per covered individual. If you need to have any basic services, including preventative services like a cleaning or your routine exam, covered out to you, no charge. You're not responsible for anything. Walk in, you walk out, you pay nothing. Any basic services, you're responsible for 20% after your deductible. Basic services is going to include not only fillings, but also periodontal scaling and root planting, which is like those deep cleanings, as well as root canals, which is great. A lot of plans cover root canals in major, but your plan covers it as basic. In the major category, you're going to be responsible for 50% after deductible, which is going to include extractions, surgeries, crowns. Your benefits are the same both in and out of the network. Deductible is $50 for an individual, not to exceed $150. So if I have 2 people covered in my family, we're each going to have a $50 deductible, which means my family would pay up to $100 a year in deductible. Let's say I have 5 people in my family. We're each going to pay $50 only for the first 3 people. So the first 3 people that utilize their benefits and require deductible, they're going to pay the $50 deductible. The other 2 people in my family would never have to, because it's collectively as a whole that $150 benefit max. Questions about your dental plan? Guardian provides to you as a reward for participating in their dental plan a college tuition benefit. This is going to allow you to save money to use towards a dependent's future college education. You cannot use the money for yourself. If you do not have a qualified dependent, I do suggest that you still register with the site, because the money will grow and accumulate and you can use it later. Qualified dependents are going to include your children, stepchildren, grandchildren, nieces, nephews, godchildren. So essentially, as long as you can gather the name, date of birth, and address for these children, they are able to be considered your qualified beneficiary. You do need to register for this site, which is on the bottom of the page, www.guardian.collegetuitionbenefit.com, in order to receive the points. You're going to get 2,000 points every year, and then you get an additional 500 bonus points for every child that you register. There are a few important dates that you need to keep in mind, and they are on Employee Navigator, but all dependent children must be enrolled as a dependent under your policy prior to them entering the 11th grade. And you have to choose whether or not you would like to utilize the funds for a dependent prior to them entering the 12th grade. Again, information is going to be found on Employee Navigator, and I will talk about Employee Navigator in a couple minutes. Next, your vision is through Guardian and utilizes the Davis Vision Network. Zero changes to this, so this is going to just be a little review for you. Eye exam, you have a $10 copay. If during that eye exam find out that you need to get glasses, you're given a $130 allowance for frames and then a 20% discount off the balance above the $130. However, there is no additional discount at Walmart and Sam's. Then the lenses themselves, you're responsible for a $25 copay. That's going to cover the single vision, bifocal, trifocal, lenticular lenses, the standard plastic lens. If you would like to opt for additional features such as anti-glare, anti-scratch, progressive, there is an additional charge, but you still get the member contracted rate. You do have the option of electing contact lenses instead of glasses, and you're given a $130 allowance and 15% off the balance. If you choose to go outside of the network, you may do so. Just like any other plan, it is going to cost you more if you choose to go outside of the network. You will have to pay out of your pocket, then complete a claim form, send it in for reimbursement, and then you are sent back reimbursement depending upon what type of care and services you have received. You're eligible to get an eye exam every year, new lenses for your glasses or contact lenses every year, and new frames every other year. If this is the off year that you cannot get frames, what you can do is you can pay out of pocket for the frames, still getting a discount because you have the insurance, or they can actually take your old frames, pop out the lenses, and replace them, and then all you're going to pay is the lens copay. Any questions about the vision plan?
No.
Okay. Every single individual, even if they choose not to have any other benefits, they get these next two benefits. The first one is going to be the Employee Assistance Program, which is through Guardian, and it's through integrated behavioral health provided to you by Guardian. You have access to unlimited telephonic and online services. I mean, there's a whole variety of different things. There's will review. They can help you with power of attorney. They can help you building a budget, looking for childcare in your area. Plus, you also can get a referral to get 3 free face-to-face sessions. Right now, they all might be Skype, but 3 free face-to-face sessions with a licensed counselor. The information that you disclose during the use of the Employee Assistance Program will never be made available to myself nor your employer. So let's say my husband and I were having some issues and I want to get some marriage counseling. The only information that I will ever know is that, yes, somebody used your program. That is all that I'm ever able to find out. So I just wanted to let you know that it's completely confidential, and it is definitely a great resource out there available to you. The next benefit is going to be the life insurance. Your employer is paying for $25,000 worth of life insurance for each and every full-time employee. That life insurance benefit also has an accidental death and dismemberment benefit in the matching face amount of $25,000. What that means is if you were to get sick and lose your life, you would get $25,000 going to whomever you name as your beneficiary. However, if you were to lose your life as a result of an accident, both the life and the accidental death and dismemberment policy would pay out, and you would therefore be leaving $50,000 to your qualified beneficiary. The accidental death and dismemberment benefit does actually pay out if you were to lose a limb, eyesight, hearing, a percentage as well. So it's not just loss of life. Okay, Next is going to be the question everybody is waiting for. How much does my insurance cost? Well, this year we were able to continue and pay 100% of the employee-only cost for the medical, the dental, and the vision. You do have the option of choosing 3 different medical plans this year. The plan, the 16243 that we had discussed, that is the plan that is offered to you at no charge. You can buy up to any of the additional plans if you want. You can enroll yourself in the medical, then you can enroll dental with you and your spouse and vision with you and the kids. It does not have to be matching elections, so you can mix and match and choose whichever benefits are most valuable to you. Open enrollment is going on right now. We are going to be enrolling on a new online platform. Page 10 has log-on instructions. You're going to log on to employeenavigator.com. Once you visit the website, you're going to click the login button on the top right-hand corner of your screen. You are then going to register as a new user. You're going to enter your first name, your last name, your company identifier, which is Think Big. It is case sensitive. If you ever forget, it is right here on page 10 of the benefit guide for you. So Think with a capital T, space Big with a capital B. PIN is the last 4 digits of your social, and then your date of birth. If for some reason it says that you cannot be located, that means that something has been entered incorrectly. Maybe I transposed a number in your date of birth, your name is spelled wrong, something. So if you are having any issues, you can contact either myself, Colleen Hernandez, or Debbie Rito, and our contact information is located in the bottom of the logon instructions section, as well as within the carrier contact information, which can be found a little bit lower on this last page. Once you're in and registered for the site, there's going to be a little button right here. It's going to say Start Enrollment. Debbie and I already ran through it just to make sure everything is up and running, which is the reason it says Finish Enrollment. But you would click on the Start Enrollment, and you're going to hit Get Started because it's your open enrollment and we're rock enrolling. Haha. Next, you're going to just confirm that your basic information is correct. Page number 2 is where you're able to enter your address or change your address. So if I moved this year, it would be right over here. You can edit it, etc., and then you'll need to validate your address. Here we go. We're going to use this address. My address is validated. Next, this is where you were to add any dependents on your policy right over here. Please note that we do need social security numbers. Then you would hit Save and Continue, and it's going to take you page by page for through all of your different options. So you would click on who you want to enroll in the plan. So if you want to enroll the child, you would click on the child, and then the prices would update. You can also click Compare, and all of the costs are going to come up here, as well as all of the benefits in a little side-by-side comparison over there. If you don't want the benefit, you would do nothing, scroll all the way down until you see Don't Want This Benefit. So you click on that button, and then please choose the correct reason as to why you're declining the insurance. Once you get all the way through to the end of the page, there's going to be an enrollment summary that's going to recap all of the benefits that you have elected and your total cost per pay period. You would then hit click to sign, and you are done. Any questions at all on anything we've talked about?
I just wanted to ask again, you said about for the deductibles, is it all the plans that whatever we've met in the deductible?
Yes. Yeah, all of the plans, whatever you have met will stay with you. Hold on, let me go to that page really quickly. Just the deductible, you currently have $1,500, $3,000. it is exactly the same if you choose the second, the plan in the second column. If you choose the plan in the first column, even if you thought you met all your deductible, you could be responsible for more. So if I was currently somebody that met my $1,500 deductible in the plan that I'm on right now, if I choose either plan in column 2 or plan in column number 3, my deductible is still satisfied. If I go to the plan in column number 1, though, I would be responsible for up to an additional $1,500 for myself, because that's the difference.
Right.
And yes, everything is following you for the rest of this year.
Okay, thanks.
You're welcome. Any other questions? And if we get off the call, or if there's something you're not comfortable asking in front of everybody else, both Debbie and myself, we are available. We are here to help. So you are not out on an island, okay? If there are no other questions, I just wanted to thank you all for your time and remind you that we are here.
Thank you.
Thank you.
My pleasure. Take care, everyone.
Bye.
Bye.
Everybody.
Thank you.
Bye.